Hi, I'm Dr. Mukesh Gupta from Lenest Malad. One big question of life that women always have in their mind when they are with their partner is, am I pregnant? Well, this is a million-dollar question. And the answer is very simple. Normally, when you feel that you've had unprotected intercourse and there is a chance of pregnancy, the best way to know is by doing a simple urine pregnancy test. When do you do it? You do it immediately after your missed menses. So the first thing that you ever come to know that you're pregnant is by your menses being missed. But remember, the menses can be irregular because of hundreds of different reasons. But if you missed your menses, you can check your pregnancy test the same day. All of the signs and symptoms that we claim to be signs of pregnancy, whether it is irritability, headache, nausea, vomiting, heaviness in the breast and tenderness, feeling of bloating, deep pelvic pain, frequency of urination, irritability, chidchidapana, and all those kind of stuff, which are commonly said that these are the early signs of pregnancy or symptoms of pregnancy, can be in any woman. And ask your husband or your partner, he'll say that this is routinely there. But the reality is that these signs and symptoms only are the plethora of body changes which are happening when you're pregnant. But the way you need to diagnose the pregnancy is number one, by urine pregnancy test. Any urine, preferably a midstream urine, at any time of the day, can be collected in a container, and you can use a readily available quick test kit which is there at any pharmacy, and you can put in a few drops of urine in the well and see if there are two lines are coming. So the one line which says C is the control line, which will be positive by any urine. Even if you have put your husband's urine, it is going to say it is there. But the test line, that is a T line, is the one which we are looking at. So if you see a T line which is as dark as a control line, or if there are two lines, that means it is a positive test. Sometimes you may see a early faint line. Still, you need to be aware about it and you need to report to the doctor to rule out if there's any other complication or if it is an early pregnancy. Because we're also worried for some complications like ectopic pregnancy or an abnormal pregnancy or risk of abortions when there is a faint line. Or it can be as simple as an extremely early test, and now it is going to get darker a little later. Another way to come to know is some blood tests, which you can get it done by your doctor. Last but not the least, a sonography. But doing a sonography is an act which you should be doing by somewhere around 6 to 8 weeks and not as early as 4 weeks as soon as you miss your menses. So hold on, don't get your sonography done early. So in summary, the most simplest and the quickest and the best way to know that you're pregnant is a simple urine pregnancy test which checks the hormone HCG in your circulation and excretion through the urine, right? Never be worried. It is just a step away to know whether you're pregnant or not.